ORNAC Standard 2.17, Dispensing of Sterile Supplies. In this short video that we made, 2 nurses are opening their room for the day and setting up for a laparoscopic cholecystectomy. The scrub nurse is bringing the case card into the room while the circulator is turning on their boom, making sure they have a camera and everything is ready to go. The circulator moves to the head of the bed as is often the priority. All the while, the scrub nurse is setting their items and their pack in the appropriate place throughout the room. The gowns go over to the gown table, the pack is on the back table, the basin, etc. The scrub nurse is then opening their pans and has placed the bin of single items to be opened on the edge of the operating table. The scrub nurse opens their pack, all the while the circulator continues to detangle the ECG leads. In this situation, an IV had not yet been primed, so the circulator goes to do that. The scrub nurse has an appropriate platform to open their gown table on, so that's opened there. And the scrub has just opened a gown for themselves. The circulator will open gloves once the scrub is ready. The circulator continues to complete the head of the bed, ensuring it's ready to go for anesthesia, while the scrub nurse goes out to do a 3-minute scrub. During the 3 minutes, the circulator is able to complete some important tasks, whether that be checking the patient or retrieving some positioning devices. 3 minutes of scrub time ensures an adequate time for the circulator to get some tasks done. We know that everyone knows how to set up an OR and run a room quite efficiently. This is just a video to suggest a few other ways to prioritize your room while working together as a scrub and circulating nurse team. While the scrub nurse is scrubbing, the circulator is checking the preference card, making sure the sutures and the local were correct, and then she left to retrieve some irrigation. Here comes our scrub nurse, ready to rock.
She doesn't have her gloves, so you'll have to open those for her.
Typically, the circulating nurses do often end up opening many items for the scrub by finishing off their opening and telling them to go scrub. So instead of doing all the circulating duties first, it is suggested to break down the circulating tasks into smaller tasks and focusing on opening for the scrub sooner than later, allowing yourself some time to complete circulating tasks while the scrub nurse is then setting up. It took 9 minutes to set up this room and open up at the start of this day. And at this time, the nurses were not working with a huge sense of urgency. We know this could be done much quicker than 9 minutes, but the IV was not primed, etc. This video has been sped up as well for your viewing pleasure. Here the circulator stops what they're doing and is ready to open and hand off the items directly to the scrub nurse. A key point for the scrub is to keep in mind that they should be placing their items on and around their back table where they will live finally. Do not place all your items in the basin because this will cause a secondary step for you to do when you go and have to move them all again. To utilize the efficiency of this standard, scrub nurses should put all their items where they will go, not directly in the basin. The ORNAC Standard 2.17 states that sterile items shall be presented directly to the scrub nurse or placed securely on the edge of the sterile field. Items shall not be flipped. This is to improve patient safety by reducing our infection rate. Sterility and integrity shall be maintained when opening, dispensing, and transferring items to the sterile field. Expose contents so the scrub can remove the item from the wrapper. Of course, we know never to reach over a sterile field or shake an item from its package. By dispensing items directly to the scrub nurse, this reduces any risk of us doing that. Open package carefully to prevent tearing and without having the item touching the heat seal, which is on the border of the package. The heat seal and the border of the package are not considered sterile. When items are flipped, they are most likely touching the edges of the packaging. All sterile indicators are being confirmed visually by either the scrub or the circulating nurse when they're being opened and handed off like this. This is another way that things can be checked and ensured for sterility. Oftentimes, if items are flipped into the basin, we are unsure, and some incidents and good catches have been made and sets have been torn down because once the scrub scrubbed in and retrieved items from their basin, they found that in the white paper wrappings there were no sterile indicators. Right now the circulator is done opening from the scrub and is deciding not to open the mastisol and the dressing in an effort to save an extra couple of seconds. The dressing should not be opened, especially if it is gauze, before a case is completed. And at this time, the circulator has chosen not to open it in an effort to save some time. Now the scrub nurse has lots to keep them busy, and the circulator is all done there. A final check of the preference card is being done. All the while the patient is in the hallway being checked by anesthesia.
Okay. Awesome. Yeah.
All done, ready to rock.